I'm just going to be doing a demonstration, plumb line assessment, alignment and an appraisal. This is just to give you a flavour of the course, an overview of what you're going to be learning. I'm not teaching you how to do it during this, it's just purely a demonstration. And for this, and during the course, we have Nathan here who's going to be our recipient. He's wearing a gown which fastens down the back, as you'll see in a moment. But for the purposes of this training course, he's agreed not to wear the gown throughout. So he's got his underwear on underneath. So Nathan, I'm going to ask him to actually get on the plumb line for just a moment. Let's take the gown off first. So let's just undo the gown. Like I said, they fasten down the back, these medical gowns. Thank you. Just put that over here. So Nathan, if you can ask you to come and stand on the plumb line, facing the wall, feet just lined up here, heels at the back for me. Thank you. Make sure your toes are touching. So the area that we're mainly interested in is the area around L5-S1, core postural alignment. We're interested mainly in what's going on in the core area. We do look at the other parts of the body, but the main area is the core here. So I'm just going to find L5-S1 using my index fingers, the knife edges, coming down to L4. And then I'm just going to find L5 there. And I'm just going to draw a box around L5-S1 here. This is the area that we're mainly interested in. Okay. And now I'm just going to extend the gluteal crease, excuse me Nathan, up through the spinous processes. And now I'm just going to find where the plumb line is actually, and C7 as well. I'm just going to do it at C7. Okay, I'm going to find where the plumb line is actually landing. So if you can just breathe in, Nathan, close your eyes and breathe out. And I'm just going to mark it down when he's breathing out fully, where the plumb line is actually landing. And the distance that we're interested in is here. It's called the drift at L5-S1. So the plumb line should land ideally where through the middle of the spinous processes, but it's landing to the left because he's leaning over to his right. So this distance here means it's the drift. He's drifting so far this distance to the right here at the centre of gravity, and that's 14 millimetres. At C7 area, it's actually less, so he's actually drifting here 6 millimetres. We need that figure just to calculate something in a moment. So I'm just going to write on here which hip is going anterior. And to do that, I need to come and stand and look over the top and see which hip is actually rotating anterior. And it's his right hip is anterior. Off the plumb line, just because his muscles are getting tired. It happens because of the way we're standing, because our toes are pointing inwards a little bit, so we get a better reading of what's happening with the posture. So Nathan, can you get back on the plumb line and face the wall, please? So what I need to do now is mark underneath this right anterior hip. So Nathan, I'm going to be making some marks underneath this right anterior hip because I want to find what we call the contact point, the point that is going to bring him back into alignment relative to the plumb line. It's going to bring his right hip back and it's going to address that drift. So let me just mark his thigh up. Excuse me, it just feels a bit strange because I'm just going to bring my hands up to the top of your thigh there. I'm just going to make a mark underneath the buttock. This is the midline. That's going to be point A. I'm going to extend the gluteal fold from the midline, most medial point, round. So it crosses. So these 2 points cross. Now I'm going to divide his thigh again from A to the most medial point where your seam comes up. And that's going to be point C. We'll go over how you do this division later. I'm going to divide those 2 points up again. Point B and those 2 points D. So I've got these 4 points here that I've marked up, and because of the drift here, I know that I'm probably going to be using contact point A, possibly contact point B. So I'm just going to test both of those. Okay, Nathan, I'm just going to put my finger underneath here. Just take up the slack of there. I'm pointing with this contact point to the tip of the opposite shoulder. Don't worry about how we work this out. Just breathe in, close your eyes and breathe out. Okay, I'm just going to let that go. I don't know if you saw that, but you can see him. If I just pick up the slack there, just breathe in, close your eyes and breathe out. I'm just adding a little bit of extra tension. He's correcting his drift, his right anterior hip's coming forward. I let go, he drifts back. So I know that this is the contact point that I'm going to be using for his alignment later. So we've got right anterior contact point A. What I also want to do with him standing in this position is check the tilt just at L5S1. I'm not looking at the lumbar lordosis, but just here at L5S1. This is one reason for having this box. So we know we're just focusing actually at this particular point. And I'm just coming down and I'm just feeling the quality of this. So this is a little bit subjective, but you do get used to it, and we will talk, like I say, more about all of these. So I'm just feeling for the quality of that. And I just want to know if it's level, i.e. I don't need to do anything with it, or if I want to increase it, or if I want to decrease it. And actually, I'm going to say for Nathan, that's level. That's okay, we're going to leave that as level. Right anterior, contact point A, the tilt is level. What I need to check now is how much he might be leaning forward. So to do that, I need him to step off the plumb line, because I'm going to turn the T-piece in 90 degrees. I want his right hip facing me. So if I do this. So Nathan, if you can get back on the footboard facing that way, thank you, that's wonderful. So there's 3 points here I'm going to do some measurements at. I'm just going to roll this up a little bit, just so I've got more access. I'm going to be using the greater trochanter, the big lump here, the top of the femur. This is all related to what's going on in the core area. I'm just going to put a line there where it should be. Then I want the sulcus here, the top of the shoulder, and just following the ear. Now, ideally, this is where the plumb line would land. Okay. Going to ask Nathan to breathe in again. Close his eyes and breathe out whilst I just mark where the plumb line is. Okay. Now you notice when I'm drawing where the plumb line is, I've got a nice square base. I have got one eye closed and I'm lined up with the plumb line. And as my eye is on there, I'm just marking at the same time. I don't open my eye. I just keep in behind the plumb line so I can get an accurate mark of where it's actually landing on his body. So the amount of lean he's going forward here at the greater trochanter is actually it's 52 millimeters. Here it's 4 millimeters, and here it is 33 millimeters. I mean, there are other things we could look at, obviously, with his posture, which you've probably noticed, but I'm not going to discuss that now. Maybe we can bring the camera over so we can have just a closer look at these markings. So this is ideally, just let your arm relax, thank you, where the plumb line should be, coming down through the middle of the greater trochanter, and this is where it's actually landing. So that difference between them is how much he is actually leaning forward. If I was to bring him back, you would see that would sort of straighten him out. So he's actually leaning forward. Same here. This is the point, this one here, is ideally where the plumb line should be, and this is where it's landing. And here it should come down through the middle of the ear hole in line with that, and this is where it's actually landing. Like I say, we could talk about other things that are going on with his posture, but this is not where we're doing that. So for now, we have finished the plumb line assessment. We're going to move on to the alignment. Thank you, Nathan. We need to get Nathan onto the bench now for the alignment, sorry. So Nathan, if you can come over here, you're going to be lying on the bench, forehead on there, chin clear of here. This will be roughly underneath your pelvis, but I can alter the position of that. So if you'd like to just get on there for me. You do need to be clear about giving them instructions and touching where you want them to put their various body parts, like the forehead. just come over to me a little bit. He was just too far there. So I'm just going to put this foot support underneath. This does two things, two main things. It relaxes the hamstrings and it relaxes the lower back. I'm just going to bring him up so you can see him. And also what it does is it allows me to have access to the abdominal area, which I will need later on. So I'm just going to put a warm towel over his feet, just so it means, this potentiates the parasympathetic tone, the healing part of the nervous system. Also, it just gives him a little bit of privacy, so he just feels that little bit more comfortable. And your recipients really do appreciate having a warm towel on. So now they're starting to relax, ready for the alignment. So I think I need him just a little bit higher still. That's good. Great. I've got a good body position. I'm level with the pelvis here. I can get to his neck and shoulder area quite easily. I'm going to put my contact thumb, the very tip of my thumb, my left hand here on this right side, on the contact point A. I've just got the tip of it pointing to the opposite shoulder. I'm keeping my thumb level with the earth to deal with the tilt, and I'm just going to pick up the tissue a little bit to deal with the fact that he was leaning forward. So I'm just lifting the tissue up towards the ceiling. So I've got my thumb on the contact point with the correct aim, tilt and lean. And so you can see a bit more clearly. Alan's just going to come in with the camera and then you'll be able to see more what I'm doing with the rest of the alignment process. Okay, so I'm going to hold my contact thumb here with the correct aim, tilt and lean for at least 10 seconds. I'm just tuning into Nathan's body, get a feel for what's going on. He's tuning into me a little. He's just getting used to the idea that I've got a thumb here underneath his buttock. His breathing's changed. There, he just did a nice out breath. So that's a good indication that we can move on. Okay, so we finished the first holding the contact point for 10 seconds, minimum of. So we're just going to come to the L5-S1 area and we want to hold this for 10 seconds using the pad of the second finger is what I'm going to be doing. So I'm here, the thumb's still got the correct aim, tilt and lean. Wow, Nathan's just had a really nice deep breath, so that just tells me that I can do the signalling, which is a rubbing across and up and down. And I just want to reinforce the message here, so I'm doing some points around L5-S1 that we call reinforcement points. It's covering various muscles and ligaments in the area that are holding on to what's happening between the relationship between L5-S1. Now I'm going to do the buttocks, lots of postural muscles here. I'm coming up the lateral edge of the thigh, just dipping into here, top of the femur, coming in and down. And I'm just going to make a pattern here. We call it a teardrop pattern. So I'm coming around, constantly using the same sort of rub outs at the moment. So it's a teardrop pattern. I'm aiming to come back to here. It means that I cover as much of the tissue in the buttock area as I can to release some of the patterns that they've got into from holding Nathan in this sort of postural distortion. Now the pressure that I'm using here, I'm not on the skin, I'm just taking up the slack of the skin and I'm contacting the tissue underneath, and that's where I'm applying my light contact. So I'm on the second point on the most lateral edge. If you imagine the trouser seam coming up here, I'm just going to move up. So I'm below the iliac crest and I'm going to come round and I'm going to finish sort of level round about S4. And if you imagine in this area here, there's lots of lymphatics, lots of drainage that maybe we can stimulate with what we're doing here. And this just allows the change that we're initiating with this contact thumb to happen. I'm coming to this same side. I have to twist my hand around to get into that point, the first one here, just at the top of the femur. I'm coming in and down, and a similar pattern. So I'm going to try and remain square to the body, protect my body at all times. So it's important because then I can treat more people. So what we need to do is get the rhythm that suits Nathan. If I go too fast, he doesn't move so much. If I go too slow, he doesn't. But if I get the right rhythm, he moves from head to toe. It's like a gentle rocking action. Stimulates the spindle cells in the muscles to release. And if you imagine each cell is like a bag of cytoplasm, we're just getting a vibration going through all the muscles throughout the body. All that cytoplasm is wobbling, and that just really allows so much change to happen as far as the posture is concerned for us, which has dramatic effects for the general health. I'm coming down below the iliac crest and round. I'm going to be finishing roughly level with about S4. All the time I have to keep monitoring what my contact thumb is doing. That the aim, I'm still aiming here, I'm level and I'm lifting the tissue up. I'm coming back to L5, S1. And what I'm going to do this time is I'm going to go between the interspinous spaces, coming down the median crest of the sacrum initially. Coming back. So I've come back to L5, S1, and now I'm going to work my way up to the external occipital protuberance. It's that bumpy point in the middle of the back of the skull of your occiput. I'm here working between each of the spaces between the vertebrae, covering the muscles and ligaments in that area. And again, I'm just keeping a nice vibration going here for Nathan so his body can respond. He's getting more and more relaxed, and in that deep relaxed state, rest, it initiates, we can have restoration. So rest of the tissues leads to restoration. You might see there's some little red spots. That's just because he's a little bit tight in these areas, a bit of inflammation. And that sort of coincides really with what we saw at posture at the plumb line. Just coming up. So I'm working my way up the cervical area, all the way up to just underneath the base of the skull and the ELP, and I'm just going to put 2 fingers underneath here, check my contact thumb. I'm just tractioning, I'm taking his head superiorly away from the bench. I'm not pushing down, I'm just taking it away, and I'm going to hold for 10 seconds roughly, and then I'm not going to release, and I'm going to do a pumping action. So it's a pump, release, pump, release. I'm taking his head that little bit further superiorly, and his whole body is coming with me, and that's enough. It's a bit of a cranial pump action. I'm coming back to L5, S1, and I'm going to do the erector spinae or the paraspinals. Work my way first of all. Starting opposite L5, S1, over the transverse process, coming to me, over the transverse process. I'm just going to come down and cover the sacral area, just over the lateral crest of the sacrum. And I'm working my way down S4, S5 area. I'm going to come back up to L5, S1. Let me just check my contact thumb. And I'm going to work my way up. Now, when we get to roughly this sort of lower angle of the scapula, I'm going to start fanning out a little bit so I cover more postural muscles. And they can feel tight on one side more than the other. You can actually see ridges of tight muscle quite often, and they can be quite tender sometimes. So I'm just coming up now. Here's the lower angle of the ribs, so I'm going to work up to that point. Check the contact thumb. So from here I'm just going to start coming out a little bit This looks a little bit like a trellis pattern. That will become clear later on in the course. You'll actually see the pattern. So I'm following it. I'm not on bone, I'm on soft tissue here. So I'm not coming onto that medial edge of the scapula. I'm staying in the soft tissue, and you can see there's some more little red dots here as his body's just releasing a little bit. And I'm coming out to this area that we call the trigone, where the scapula meets the clavicle and the head of the shoulder. So I'm just going to stay in the soft tissue though at all times. It's the same rub out across and up and down, same level of contact all the way through. So I'm finishing here. Now I'm going to do the points on the trapezius muscle, the mid-trapezius. I'm just going to pick up the muscle with my middle finger here. I'm just going to roll, release, roll, release. So it's a sort of vibration again. Do 3 of those on the opposite shoulder. Coming across to me, picking up the tissue. You can see I've got the belly of the tissue there. Just roll, release, roll, release. I'm not pinching, I'm just rolling the tissue. And I'm finishing here on this midpoint. Let me just check my contact though. Now I'm going to use the knife edge of my index finger, and I'm going to be picking up the sternocleidomastoid particularly, but the neck muscles. Again, you can see I've got the belly of the muscle there. My thumb is acting as a pivot, and I'm going to roll towards my thumb, and I'm going to do 4 points in this neck region. And now I'm finishing here, and I'm just going to tuck my knuckle here on my index finger underneath the mastoid process, thumb underneath the lateral occipital protuberance. I'm going to pump, release, pump, release, pump, release. Keep my finger where it is, move my thumb over. Both of these lateral occipital protuberances, we'll show you how to get into these hand positions, don't panic. We're going to be teaching you all of this later. So what I need to do on this side is some key postural muscles, and they are the abdominal muscles. I'm just going to slide my hand underneath it, which is one good reason for having the paper here, so you don't stick. And I've just got the ASIS, the hip here, in the palm of my hand. I've got my index finger underneath, my second finger underneath, supported by my index finger. And I'm just going to lift the tissue up and release 3 times. And I'm going to work my way up the abdominal area here. I'm not on the midline, I'm just underneath the transverse processes. Nathan's a little bit sensitive, which is very common, that people have quite sensitive abdominals. So you don't go in too heavy, it can be quite tender as well. I'm just underneath the angle of the rib here in the abdominals. And that's the last abdominal point here. So what I want to do now here is to lock in what I've done so far. So I'm just going to flick my thumb, accentuating my aim, tilt and lean. So you saw the little wobble there in the sacral area. And what I need to do just to finish on this side before I come round to work on the other is to do some effleurage. So using the palm of my hand, I'm coming up the middle of the spine, across and down, up. I'm taking the sacrum in as well, up, across and down. Just calms everything down. Eventually people get to understand that this means you're going to move to the other side. So we finished the alignment procedure. Actually Nathan fell asleep, he was that relaxed, which in these conditions says something. So what we need to do now, actually, we need to get him off the bench. So I'm just going to lower the bench down, because he's likely to feel very woozy because he's been lying down there for much longer than you would do in a clinical situation, because normally that would just take 15 minutes or so. I'm not sure how long he's been lying down. Just a moment, don't rush. Let me just take this from underneath your feet. So thank you. You have to be very clear about the instructions. Some don't want to get off and some can't wait. Do you want to come and sit with your back towards me and be here? Thank you. You want to be behind them, giving reassurance. I'm just going to lower the bench so he can put his feet down on the bench. And he's just going to come round. And when he's come round, we're going to do an appraisal, a post plumb line assessment. Okay, we're just going to do an appraisal. It's a post alignment assessment, and what we're going to do is we're going to compare the changes before and after. And you can see that I've left the foot piece here facing side, so we can have a look at him laterally to start off with, so I don't have to change the foot piece too often. So Nathan, can you come and stand on here, side on? Okay, let me just find my earlier marks. There we are. Now Nathan, if you can just breathe in, close your eyes and breathe out. Okay, you can open your eyes. So, there's been a little bit of change here. And actually at the greater trochanter, his reading is now 55, whereas I think it was, let me just check, it was 52. So now it's 55, but don't panic if it appears worse, because it's not worse, it's change. If we look here at the shoulder, he's now, instead of being behind the plumb line, he's becoming front. So this would be minus 15 millimeters. So this is where he's changed quite a bit, which is great. And here at the sort of neck area, it is now 27 millimeters, whereas it was 33. So that's a little bit of change here. And if you want, you can come in with the camera. So at the center of gravity here, you can see the change, which is minimally. Is leaning forward a little bit more at the plumb line. If we move up to the shoulder area, what you can see is he's straightened up quite considerably here around the shoulders, which, if you remember what he was like before, that is actually a really positive thing for Nathan, this change here. Even though we've focused on trying to bring a big change at L5S1, it's resulted in him having a change structurally here in this shoulder area, and minimal change here with the chin. So this is really positive for Nathan, because there's lots of things going on in this, the whole chest area. Now we'll have a look from the back. So when you're ready, breathe in, close your eyes and breathe out. Okay. Let me just check the tilt. The tilt is still level. Here, before it was 14 millimeters on the opposite side of the anterior hip, but this time now he's altered quite a lot, and it's 13 millimeters on the same side as the anterior hip. So there's been a huge shift in this L5S1 lower back core area of his posture, and up here it's now on the same side as the anterior hip, 11 millimeters instead of on the opposite side of 6. So again, some wonderful changes, and for those of you who've already been assessing posture, you will see some of the other changes that are happening. Would you like to come and have a look? Okay, so what we can see here at L5S1, you can see that the plumb line is on the same side as the anterior hip, and this is like a wonderful change. And we're not looking for necessarily ideal coming up through the middle, we're just looking for change. And again, if we have a look at the cervical area, is it on? Then it's on the same side as the anterior hip. So there's been quite a uniform change though, which is wonderful. And the tilt here at L5S1 is level. Just going to have a look to see what the anteriority is like. Before it was very right anterior. And it's still right anterior, but it is considerably less. Considerably less actually, which sort of explains a lot what's happened, the change that we've got here at L5S1. So that's the post appraisal assessment.